Once again, I am Sydel Gomez, a third-year student taking a Bachelor of Secondary Education under the College of Education, and this will be the last lesson that I will be discussing. It's all about assessment for students with exceptional needs that is taken from Chapter 5 of the materials that Dr. Craig Euphoria provided to us. Nowadays, it's common for students with exceptionalities to be taught in general education classrooms. Teachers are responsible for gathering assessment information when a disability is suspected and informing special education eligibility decisions. Once special education services are in place, appropriate assessment accommodations are needed to ensure fairness and accuracy in gathering evidence of their learning. They have the right for inclusive education as mandated by the law. Now, these are the objectives for today's report. At the end of the lesson, the students will be able to first identify the different learning disabilities, second, discuss the legal mandate, and third is differentiate the two examples of learning disability presented. Now, before anything else, let us first identify who are those learners with exceptionalities. Students who experience difficulties in learning, who show superior performance, or who require a change in instruction or curriculum to help reach their full potential are considered exceptional learners. Now, exceptional learners are supported academically through methods such as special education services, response to intervention, and gifted or talented programs. Now, this is the legal mandate. In 1975, the Education for All Handicapped Children Act was passed. It provided FAPE for school-age individuals with special needs in the LRE. The Act was updated in 1990 as the Individuals with Disabilities Education Act, or IDEA, and it was reauthorized in 1997 that states that it requires states to establish procedures to ensure that students with special needs are educated to the maximum extent possible with students who are not disabled, LRE. It is clear and evident in the legal mandates that students with exceptionalities also has the right to go to school just like a normal student as per mandated by the law. Further, we also have the term inclusive education, wherein inclusion and education refers to a model wherein students with special needs spend most or all of their time with non-special general education needs students. Inclusion rejects the use of special schools or classrooms to separate students with disabilities from students without disabilities. Schools with inclusive classrooms do not believe in separate classrooms. They do not have their own separate worlds, so they have to learn how to operate with students while being less focused on by the teachers due to a higher student-to-teacher ratio. In addition, it arises in the context of special education with an individualized education program and is built on the notion that it is more effective for students with special needs to have said mixed experience for them to be more successful in social interactions, leading to further success in life. IDEA specifies 13 disability categories as guidance for identifying students as eligible to receive special education services, such as those people who experience traumatic brain injury, or those people who have visual impairment, speech or language impairment, specific learning disability, orthopedic impairment, and other health impairments. However, out of the 13 presented disabilities, I will only discuss two, and that is emotional disturbance or disturbed and intellectual disability. Intellectual disability, or ID, also known as general learning disability and formerly mental retardation, MR, is a generalized neurodevelopmental disorder characterized by significantly impaired intellectual and adaptive functioning. It is defined by an IQ under 70 in addition to deficits in two or more adaptive behaviors that affects everyday or the general living. Adaptive behavior is defined in terms of conceptual, social, and practical skills involving tasks performed by people in their everyday lives. Once focused almost entirely on condition, the definition now includes both a component relating to mental functioning and one relating to an individual's functional skills in their daily environment. As a result of this focus on the person's abilities in practice, a person with an unusual low IQ may still not be considered to have an intellectual disability. Non-syndromic or idiopathic cases account for 30 to 50% of these cases. About a quarter of cases are caused by a genetic disorder, and about 5% of cases are inherited from a person's parents. Cases of unknown cause affect about 95 million people as of 2013. Intellectual disability affects about 2 to 3% of the general population. 75 to 90% of the affected people have mild intellectual disability. Among children, the cause of intellectual disability is unknown for 1/3 to 1/2 of cases, and that could either be because of a genetic condition, problems during pregnancy, problems at birth, exposure to certain types of disease or toxins, iodine deficiency, malnutrition, and absence of arcuate fasciculus. These are the early signs of intellectual disability. It can include delays in reaching or failure to achieve milestones in motor skills development such as sitting, crawling, and walking. Slowness learning to talk or continued difficulties with speech and language skills after starting to talk. Difficulty with self-help and self-care skills such as getting dressed, washing, and feeding themselves. Poor planning or problem-solving abilities, behavioral and social problems, failure to grow intellectually or continued infant childlike behavior, problems keeping up in school, failure to adapt or adjust to new situations, and difficulty understanding and following social rules. Next, we go on to emotionally disturbance or disturb. IDEA defines emotionally disturbance as follows: a condition exhibiting one or more of the following characteristics over a long period of time and to a marked degree that adversely affects a child's educational program. The letter A is an inability to learn that cannot be explained by intellectual, sensory, or health factors. Letter B, an inability to build or maintain satisfactory interpersonal relationship with peers and teachers. Letter C, inappropriate types of behaviors or feelings under normal circumstances. D, a general pervasive mood of unhappiness or depression. And the last letter E, a tendency to develop physical symptoms of fears associated with personal or school problems. As evident in IDEA's definition, emotionally disturbances can affect an individual in areas beyond the emotional. Depending on the specific mental disorder involved, a person's physical, social, or cognitive skills may also be affected. The National Alliance on Mental Illnesses of Southern Arizona puts this very well. Mental illnesses are medical conditions that disturb a person's thinking, feeling, mood, ability to relate to others, and daily functioning. Just as diabetes is a disorder of the pancreas, mental illnesses are medical conditions that often result in a diminished capacity for coping with the ordinary demands of life. Some of the characteristics and behaviors seen in children who have an emotional disturbance include hyperactivity, that is short attention span and impulsiveness, aggression or self-injurious behavior, that is acting out or fighting, withdrawal, that is into not interacting socially with others, or excessive fear or anxiety, immaturity, that is inappropriate crying, temper tantrums, poor coping skills, and learning difficulties, that is academically performing below grade level. Now, the mental health of our children is a natural and important concern for us all. The fact is, many mental disorders have their beginnings in childhood or adolescence, yet may go undiagnosed and untreated for years. We refer to mental disorders using different umbrella terms such as emotionally disturbance, behavioral disorders, or mental illnesses. Beneath this umbrella of terms, there is actually a wide range of specific conditions that differ from one another in their characteristics and treatment. This may include anxiety disorders, bipolar disorders, conduct disorders, and so on. We should also remember that let's keep an eye on our students when it comes with their mental health issues because they are real. Even if we don't see it, they are present. These are the references for today's lesson, and I guess this may also end the lesson, my discussion, or my report. And have a good day, everyone.